Clinical nutrition is often misunderstood. Many people assume it is about food charts, calorie counting, or diet plans. In reality, clinical nutrition is a medical science that studies how nutrients interact with human physiology, metabolism, and disease processes. At its core, clinical nutrition focuses on the application of nutrition in health and disease. It integrates principles from biochemistry, physiology, endocrinology, immunology, and pathology to understand how nutrients influence cellular function, organ systems, and clinical outcomes. To understand clinical nutrition properly, we must first distinguish it from general nutrition. General nutrition typically focuses on population-level recommendations, what healthy people should eat to maintain basic health. Clinical nutrition, on the other hand, is patient-specific and condition-driven. It asks medical questions such as, why does a patient with chronic inflammation require different nutrient support? Why does insulin resistance alter fat metabolism? Why does malnutrition delay wound healing and recovery? These questions cannot be answered by diet charts alone. They require an understanding of pathophysiology. Clinical nutrition operates at multiple biological levels. At the cellular level, it studies how nutrients regulate energy production, mitochondrial function, oxidative stress, and cellular repair. For example, glucose is not just a carbohydrate. It is a substrate for ATP generation. Magnesium is not merely a mineral. It is a cofactor for more than 300 enzymatic reactions, many of which regulate nerve conduction and energy metabolism. At the organ level, clinical nutrition examines how nutrition affects the liver, gut, muscle, brain, and endocrine organs. The liver regulates glucose and lipid metabolism. The gut controls nutrient absorption, immune signaling, and microbiome balance. Muscle tissue is a major reservoir of protein and amino acids during illness and stress. At the systemic level, clinical nutrition evaluates how nutrients influence hormonal balance, inflammation, immunity, and metabolic adaptation during disease. One of the defining features of clinical nutrition is its clinical orientation. It is not opinion-based, it is evidence-based. Clinical nutrition decisions are guided by clinical history, physical examination, laboratory investigations, imaging, and functional markers, patient response to intervention. For example, anemia is not treated merely by giving iron. A clinical nutritionist must determine whether the anemia is due to iron deficiency, inflammation, malabsorption, chronic disease, or vitamin B12 deficiency. Each cause requires a different nutritional strategy. Clinical nutrition also plays a critical role in disease prevention. Many chronic diseases, including diabetes, cardiovascular disease, fatty liver disease, osteoporosis, and sarcopenia, begin years before clinical diagnosis. Subtle metabolic disturbances, micronutrient deficiencies, and hormonal imbalances often precede overt disease. Clinical nutrition aims to identify and correct these disturbances before irreversible damage occurs. In hospital and critical care settings, clinical nutrition becomes even more essential. During illness, surgery, trauma, or infection, the body enters a state of metabolic stress. Energy expenditure increases, protein breakdown accelerates, micronutrient requirements change. In such situations, inappropriate nutrition can worsen outcomes, while targeted nutrition can improve recovery, reduce complications, and shorten hospital stay. This is why clinical nutrition is integral to intensive care units, oncology care, renal and hepatic disease management, maternal and neonatal health, geriatric care. Another key principle of clinical nutrition is monitoring and outcomes. Interventions are not static. They are continuously evaluated using clinical parameters such as blood glucose and insulin markers, lipid profiles, inflammatory markers, electrolytes, and micronutrient levels. Functional outcomes such as strength, healing, and quality of life. Nutrition is adjusted based on response, tolerance, and evolving clinical status. It is also important to understand who practices clinical nutrition. Clinical nutrition is practiced by trained professionals. Clinical nutritionists, dietitians, physicians, and researchers who work within defined medical and ethical frameworks. It is not based on trends, testimonials, or one-size-fits-all protocols. In this educational series, we will approach clinical nutrition as a foundational medical science. We will move systematically from molecules to metabolism, from physiology to pathology, from theory to clinical application. Each concept will be explained clearly, scientifically, and without oversimplification. Clinical nutrition is not about restriction or rules. It is about understanding how the human body responds to nutrients and using that knowledge to support health, recovery, and long-term function. When understood correctly, nutrition becomes medicine.